Mommy makeovers can be life-changing. I see it every week in my practice. But here's what I've noticed. Whether someone is just starting the research or ready to book a consult, most people focus on the procedure itself. What it includes, what the results will look like, how much it costs. But there's one thing most people don't prepare you for. It's not the surgery, it's not the results, it's not the scars. It's the recovery. So in this video, I'm going to walk you through what a mommy makeover actually is, what it can and can't do, what the first week of recovery really feels like, when you can safely return to your normal routine, and when the swelling finally settles so that you can see the actual results. All right, let's get into it. I'm Dr. Ryan Sujimura. I'm a board-certified plastic surgeon in Scottsdale, Arizona. I specialize in cosmetic and revisional surgery, and mommy makeovers are a big part of what I do. The mommy makeover is one of the most comprehensive procedures we do in plastic surgery. It typically includes a combination of tummy tuck, breast lift or augmentation, sometimes both, and liposuction. It's not for everyone, and the best candidates are women who are done having children. They've been stable in weight for a while. They don't smoke, and they understand the reality of scars and recovery. And I want to say this clearly, a mommy makeover is not a weight loss tool. It's a body contouring procedure, and it removes loose or excess skin. For example, with a tummy tuck, we're not just removing loose skin, but we also repair the separation of the abdominal muscles, called a diastasis recti. That helps your midsection look flatter and feel stronger. Our breast lift or augmentation can restore shape, positioning, volume, and liposuction can refine areas around the waist and torso to improve contours and smoothness. Basically, it's a chance to get the result you've been imagining in a way that still looks natural, and to look in the mirror and feel like you recognize yourself again. Now let's talk about customization, because this is where a lot of confusion happens. You hear terms like mini tummy tuck, full tummy tuck, fleur-de-lis. They sound similar, but they're not the same procedure. A mini tummy tuck targets the lower pooch, the area under your belly button. It doesn't involve going above your belly button or tightening the muscles. It's a good fit if the looseness is mild and mostly limited to the lower stomach. However, if you tighten the lower stomach muscles, it may cause the upper stomach muscles to become more relaxed or pooch. A full tummy tuck addresses the loose skin above and below the abdomen and often includes the muscle repair. It's more involved, and it typically needs more downtime and more help during the first week. A fleur-de-lis is a tummy tuck for people who have lost a lot of weight, 300 pounds or more, with a lot of extra skin. Not just up and down, but also side to side. Think of someone who's lost a significant amount of weight. To tighten that much extra skin, it usually requires an extra incision, which is usually vertically in midline, in addition to the one that's horizontal around the hip bones, which is why you end up with an extra scar. It really depends on where the looseness is, what kind of shape you're trying to get back, and what we can do to safely create a smooth, natural contour that lasts. Now let's shift to the breast, the other half of the mommy makeover. Pregnancy and breastfeeding usually change two things at once, position and volume. And there are a few different ways to restore that. But the last thing you want is the wrong solution for the wrong problem. That's why the consult matters. It's how we match the plan to what your body actually needs. Let's start with a breast lift. A lift is about restoring position and shape, not necessarily volume. A lift restores the position and shape of the breast, tightens the skin, and brings the nipple back into a more natural position, so everything sits where it should again. A lot of women describe it as looking perkier, more centered, and more like their pre-baby body. Whereas an implant, such as a silicone or saline, restores fullness, especially in the upper pole of the breast. So you get rounder, more youthful volume that can disappear after pregnancy or breastfeeding. It can make a big difference in how you look in bras, swimsuits, and fitted tops. Essentially, you won't be needing all that extra padding or push-up bras just to feel like you have shape again. And if you got both droop and volume loss, an implant plus lift can be a great option. In fact, breast augmentation is one of the most requested parts of a mommy makeover, because pregnancy and breastfeeding, and even weight loss, can leave you with less fullness than you used to have. This combo restores shape and position. It brings back volume. At the same time, you get that lifted look, that filled out shape again, especially in bras, swimsuits, and fitted tops. That's why a lot of women end up choosing this option. It looks balanced and feminine, and you feel confident again, getting dressed, looking in the mirror, and especially when you're going out. What about liposuction? If a tummy tuck is what tightens and repairs, liposuction is often what refines and shapes. It can sharpen the waistline, smooth contours. But again, liposuction is a contouring procedure, not a weight loss procedure. In the consult, and this is the best part, we discuss your vision, the results you've been picturing for yourself, what you want to restore, what you want to change, what you want your shape to look like in real life. Sometimes you'll bring reference photos in and we'll go over real patient results. So we're speaking the same language and we're on the same page. Then we build a plan that fits your body so it looks natural and holds up long term. And part of the conversation is deciding whether everything should be done in one surgery, or if it's smarter and safer to stage it into 2 separate surgeries. Combining can make sense when you're healthy, weight stable, and a full plan can be done within a safe amount of time under anesthesia. Now let's talk about recovery. In the first few weeks, the focus is on recovery, not results. Swelling and firmness can hide the work that was done underneath. You can see preliminary results early, but it's around 6 to 8 weeks when swelling usually settles enough so you can really start seeing the shape coming through. Your clothes will fit better, your waistline begins to look more defined, and moving feels more natural. Keep in mind, even when you're feeling better and seeing changes, your body is still healing and tightening behind the scenes. Some swelling can linger for a few months as everything calms down. And your final results usually keep improving over time, especially if you continue to diet and work out. Often anywhere from 6 months up to a year, depending on what you had done and how your body heals. So if you feel like you look worse before you look better, you're not behind. You're on a normal timeline. Knowing that ahead of time makes the process less stressful and helps you stay patient while your results reveal themselves. Now, what about mobility? You'll be walking right away, usually starting that first week. Nothing intense, short, slow walks on purpose, just to keep the circulation moving and help your body heal. By about 2 weeks, a lot of people can start easing into light activity. But this is where you follow your surgeon's plan, not your motivation. Around weeks 3 and 4, you can usually start light cardio, like longer walks or easy stationary bike, as long as everything's healing the way it should. For heavy lifting and core workouts, that's typically closer to 6 weeks or more, and sometimes 6 to 8 weeks, depending on what you had done and how your body's healing. And that gradual return really matters, because doing too much too soon is one of the fastest ways to prolong swelling, get more sore, and slow your progress. Scars are also part of the recovery, so I want to set expectations. You won't be scar-free, but we're very intentional about where the incisions go, so they sit low and stay easy to hide, like under the panty line or where a C-section scar is, below a bikini bottom or leggings. Over time, with good scar care, they typically fade and become less noticeable month by month. And depending on your pigment, it may take longer. And what most women end up focusing on isn't the scar, it's how they feel in their body again. So the real question is, a mommy makeover right for you? And that all depends. You have to ask yourself, are you tired of looking in the mirror and feeling like your body isn't going back to how it used to be? Because here's the reality. After pregnancy or weight loss, loose skin, muscle separation, and breast changes often don't fully go back on their own. And even with weight loss and working out, they don't go back on their own. A lot of women get stronger, leaner, and that's great, but structurally, things may still not be the same. And for some women, that can quietly drain confidence over time. A mommy makeover isn't about perfection. It's making a thoughtful choice for your body with realistic expectations at the right time in your life. If you're considering a mommy makeover, the next step isn't rushing out booking surgery. It's getting clear answers. If you'd like to know whether you're a good candidate and what a realistic plan would look like for your body, you can schedule a complimentary consultation by clicking the link below this video. That visit is simply about education, clarity, and helping you decide what's right for you. Thanks for watching. I hope this helped set realistic expectations and answered some of the questions you may have been carrying. Whatever you decide, understanding the process ahead of time makes all the difference. Thanks for watching.